Okay, my name is Heun. I'm a consultant psychiatrist, and today I wanted to talk about something which is very important in the treatment of patients, which is insight. Insight is a concept which is very useful and can decide whether someone can be sectioned, at least in Scotland. However, it's very common in psychiatry, or quite common in psychiatry, and quite unusual in other diseases. So in most diseases, when people have physical symptoms, they would say, I know that my physical symptom is caused by an illness, and that's abnormal, and this abnormality can be used to find a diagnosis and appropriate treatment. That's different in psychiatric disorders sometimes, where the lack of insight and understanding is something which patients suffer with. And I might give you some example. So in people with dementia, it's quite common that they lose things because they can't find them. If they then just don't blame themselves about their poor memory, but then think that other people have stolen something to them, then it's lack of insight. So people don't understand that they have a disease, and they would then think that something which gets lost is stolen and would blame someone. I can remember a patient who had been cooking for her twins and was absolutely clear that she had two twins, and she had absolutely no insight that this was some part of paranoia, and she wouldn't even recognize her own sons, which was quite devastating for them. Paranoia, or schizophrenia, especially in people who have been hit with the first symptoms of schizophrenia, there's very often symptoms like hearing voices, or being persecuted, or feeling persecuted, hearing the voices of demons. And people with schizophrenia don't understand this. They don't see it as a disease. They see it as a symptom of social interaction, that people follow them, look at them, talk to them, intrude their voices into their head. So they can't really distinguish that, and they don't understand the concept that they have a schizophrenia, or very often drug-induced psychosis. In other people, in depression, people can think that they have lost their wealth, they're going to starve, they have a delusion that they're bankrupt, have no money, and will lose their house, or they're very guilty of other things. So these things very often are seen as personal, as seen as events, and not as part of a disease. Insight is defined as a correct attitude to morbid change in oneself. It's quite clear and simple. It includes a number of beliefs. It's not just yes or no, and it's not as simple as saying, okay, you just tell the truth to the patient and that's sorted. Sometimes it's better to understand the way a patient feels about that. So the question you have to ask yourself and the patient: does the patient believe that their abnormal experience are symptoms of something? Would the patient believe their symptoms are part of an illness? Do they believe that the illness is a psychiatric or mental problem? Do they believe that they might benefit from medication or support? And would they be willing to accept some advice from a doctor about their treatment? I can remember patients who, strangely enough, take their medication, quite happy with the medication, are thinking clearer, feel that they're, as they say, so the recent patient said, they're thinking more efficiently, but they would never say that they have a mental health disorder, and they're quite happy to take antipsychotics for quite some time, but they wouldn't think that they have a mental health problem. So the question is, so we have to understand how the patient sees their symptoms, and sometimes it's also important to see that it's not just that the patient needs to believe everything a doctor says. They might disagree with some of the actions or the medication or hospitalization, but that doesn't mean that they don't understand what they need, or that they have a mental health problems. Sometimes they do, but they disagree. So we have to make sure that we don't say that disagreement is a lack of insight. So the question is first that the doctor should be sure that the patient has all necessary information about what it is and then can deal with them. And then we have to see whether the patient has any insight or not and what we have to do with that. And sometimes this lack of insight, lack of medication, lack of care for themselves can, on the long term, can lead to very risky behavior, can lead to self-neglect, can lead to the neglect and dealing with the environment and other people, and can even risk other people if a person feels that they're threatened by someone who they're not. So I think insight is a very important concept, legally and mentally, and sometimes it is that people without any insight in their disease accept treatment, and that's a good one, and sometimes it can help, but it's much easier to help a patient if they have insight in their disorder. Right, this is our series Mental Health Explained in Global Psychiatry Archives. If you like it, please say or click the right button and subscribe to our channel. We already have quite a few videos which explain mental health. Thanks for your interest and have a nice evening. Goodbye then. Goodbye soon.